Let me quickly introduce Professor Nora Colton. Nora Colton is a doctorate from Oxford with a postdoctoral from Harvard. She was the Deputy Vice Chancellor of the University of East London. She was the Director of Education at the UCL Institute of Ophthalmology and the world famous Moorfield High Hospital. And currently she is the Director of Global Business School of Health at UCL. This is the first of its kind business school dedicated to health globally. Professor Colton, we requested you to come here at a very short notice. Thank you very much for that. A few words from you, please. Lord Patel, thank you.
Thank you so much. It's really a pleasure to be here and to listen to all of you speak. And I just want to thank you and all your distinguished guests, and also congratulate you on the opening of this London Overseas Center for LOCCA. I think it's just fantastic, and I think it provides lots of opportunities, really, across the UK, of course. It's such an important area. And so I'd like to just take a moment and talk just about this really exciting initiative that UCL is taking forward, and that is the first Global Business School of Health. And the timing, of course, couldn't be more opportune in terms of where we are as a real world society in terms of thinking about health. But before I just talk a little more about the school and how I could envision us working together, I'd just like to say a little bit about UCL for those of you who might not be familiar with the university. So UCL was actually founded in 1826. It was the third university to be founded in the UK after Oxford and Cambridge. And it was really founded on the ethos of being an inclusive university and providing education in university and higher education for those who had been excluded. So it was also the first university in the UK to admit females. And today it continues to embrace those ethos and takes a lot of pride in being disruptive, but disruptive in a very positive way in terms of bringing about good for society. So it's currently ranked in the top 10 in the world on the QS World Rankings, and it is known across the world, and particularly in the UK, for its academic excellence in research. And much of that research is around addressing real-world problems, especially in the area of health and science. And so it's just such a pleasure to have this opportunity then to be the inaugural director of this Global Business School of Health, which will share those same kind of ethos in terms of leading professionals such as yourself in developing capabilities and skills to really address the urgent needs that we see in health and healthcare management today. As we all know, not just non-communicable diseases, but communicable diseases such as COVID-19. And moreover, this school is really focused on universal healthcare services and how we can bring those about, as Lord Patel said, not just to more people, but more people at a quality and standard that's equitable and provides the kind of service that we all deserve as mankind. And so it's really with that and those thoughts then that I take this role and have this opportunity to speak to you. Because, of course, there's multiple factors of why, particularly at this time, we see so much interest in health. Some of it is because of population growth in places like India. And then in the places like the UK, it's about an aging population. We also see the rise of chronic disease. And although there are so many things that are very positive about globalization, we also see that lifestyle changes have not always been positive. And so consequently, we share more and more of those chronic diseases and need to address them as a global society. Also, technological advances, although we applaud them, we also see that they can drive up costs. And so it's very important that we understand how to get the right balance of technology, how to make sure that we're doing what is best practice as we expand our healthcare systems and bring more people into the system for care. So really, it's about addressing all of these issues. And I think one of the most important parts is the part that your members will play, and that is really being financial enablers, enabling that system to really make a difference by creating financial models, best practices, understanding costs. And to do that, we have to understand data. And to understand that data, we live in a period where we've got analytics, machine learning, artificial intelligence to enable us. But if our members and our accountants aren't able to work together and collaborate using that technology, then they also can be disablers. And that would be very unfortunate, really, for all of the people that we want to serve through our health and our health practices. So I want to really just say, that from my standpoint, one of the things that we can really do together is help to create data-driven leaders, data-driven financial departments, people who understand the various cost models and can come up with those solutions of how to expand our services while also containing those costs. We have also labor costs and specialist services and shortages that we'll need to address. So we have to learn how to work together to figure out what those best practices are, what those best care models are, what the best pathways are for us, both in terms of thinking about the NHS, about thinking about India and its health system. And of course, last but not least, we need to think about that private-public mix. How do we get that right? How do we make sure that we're engaging the private sector as well as building a strong, resilient, and sustainable public sector? So these are all very important challenges. And no doubt, India, with its population growth, combined with its economic power and efforts to expand its public health systems, will likely face an uphill battle with higher health spending and the need to figure out ways to work with its accountants, its cost accountants, its financial markets to really contain those costs while also meeting those aspirations of universal health and quality health for all. So it's really facing those challenges, both within the UK, and we are expanding and testing new models, things like population health management, integrated care, and different incentive models for hospitals and pharmaceuticals, that we can really share those insights, share our research, share the things that we're doing. And that's really the ambition of this school, to be a platform for that, to work with your organizations and other organizations in India and across the globe to really develop the education and training through executive education accreditation, as well as research projects that really identify those best practices and can build models that can be used universally across various countries. So I really look forward to working with you and particularly those of you who will be at the London Center. I hope that in the near future, we can develop a health pathway for education and training within your credentials and how you educate your members. But moreover, I look forward to collaborating in cutting edge research in the area of healthcare analytics, health innovation, and of course, financial cost modeling for health. So thank you so much.